Yeah, generally, there's always a confusion and a myth when we talk about sex and gender. Sex relates to the biological characteristics and physiological characteristics between men and women. These are no difference in between the societies, whether it's India, it's in Cayman, or United States, is the usually same differences. But when it comes to gender, that is the socially construed roles that we put into the gender equation.
So when we talk about gender issues in health, we're talking about the different healthcare needs for men and women that come down to our physical realities, our biological differences. But what's also important to consider is the differences in healthcare status and access that are a result of our gender ideology, or ideas about what it means to be a man or to be a woman. And in Western societies, traditional masculinity and femininity are seen as a dichotomy. They're on opposite ends of the spectrum. We're completely different. Masculinity is associated with being active and aggressive. You can express anger, but not sadness. And femininity, on the other hand, is associated with passivity, with compliance, and you can express sadness, but not anger. And this limits the coping strategies that we can employ when we're dealing with life situations, with things that are thrown at us. And when you limit the ways in which you can cope, females tend to internalize problems and males externalize them. And this leads us to have different health risk factors and to have different common illnesses and health issues.
Because of the physiological differences and biological differences and the gender equation, then there are different health needs to the men and women, and of course children also.
The Ministry of Health embarked on the first ever chronic non-communicable disease risk factor survey last year in collaboration with PAHO, and some private sector insurance came on board to support us financially. And one of the things that we're really looking forward to seeing from that survey is the difference in genders in terms of some of these risk factors. The survey was done and it was split into cohorts based on age and gender. So we're expecting that we'll get some really useful information that will help us really target our efforts in a gender-specific way to make sure that the messages that we're getting out are the right ones and they're reaching the right targets. It's been seen in other countries that women tend to be the ones who access preventative care more often than men. We want to see if that is reflected here in the risk factor survey results. We also know anecdotally that women quite often will make sure that they take care of the others in their family before they take care of themselves.
For example, women are at greater risk for chronic health diseases. They're at greater risk for anxiety and stress-related conditions, whereas men are at greater risk for injury or death from violence, from accidents. They're also at risk for antisocial personality disorders and for drug abuse, substance abuse, alcoholism, poor health, poor diet. And so these differences come down to our gender. It comes down to the ways in which we cope with life situations. And one of the ways that we can promote gender equality for our own health is to realize that we're not limited by what society tells us we can and cannot do. As a society, we can also teach our girls and boys and our men and women and promote public education that just because society tells you that you have to behave in a certain way, if that's bad for your health, that's not what you should be doing.